The Food and Drug Administration on Thursday approved the latest slate of annual COVID vaccines, clearing the way for Americans 6 months and older to receive updated shots in the midst of a prolonged summer surge of the virus. Pfizer and Moderna, the vaccine makers, are expected to begin shipping vaccines to pharmacies and doctors' offices within days. The shots are tailored to a version of the virus that took off this spring before giving way to closely related variants, all of which appear to spread faster. For the frailest Americans, who have been dying of COVID in growing numbers this summer, the shots could offer a reprieve from a virus that disproportionately endangers those whose vaccinations are out of date. But the approval is occurring months after wily new variants began driving up infections, a matter of consternation for some scientists who have urged faster turnarounds for updated shots. In recent weeks, people have been hospitalized with COVID at a rate nearly twice as high as during the same time last summer. By late July, COVID was killing roughly 600 Americans each week, a substantial drop from this winter, but double the number from this spring. The availability of boosters has not translated into actual vaccinations. By spring, only 1 in 5 adults had received last year's updated COVID vaccine. Even older Americans, who are at far greater risk of being severely sickened, largely spurned the shots, with only 40% of people 75 and older taking last year's vaccine. The prospects for this year's rollout remain dim. Older people were still dubious about the need for additional doses. Dr. said, the Biden administration has been scrambling to find money to vaccinate uninsured Americans, and public health departments remain short on funding for the proactive vaccination campaigns that drove uptake earlier in the pandemic. Officials said, health departments got extra money during the pandemic to send teams to people who were so disabled they had to stay at home, said Dr. William Schaffner, an infectious disease specialist at Vanderbilt University. That money's gone. Public health experts have been especially worried by modest booster uptake in nursing homes. Problems were evident a year ago, when many nursing homes waited months after approval to begin inoculations. Today, less than 1/3 of nursing home residents are considered up-to-date on COVID vaccinations, according to the Centers for Disease Control and Prevention. Long-term care experts have pointed to a number of problems complicating vaccinations in nursing homes, including inadequate staff levels and federal recommendations that older people receive 2 COVID shots a year, frequency at odds with the usual annual flu shot schedule. But despite the increasingly disproportionate risks facing older Americans, not all nursing homes put on major vaccination drives, even when local health departments offer to help.